Hello and welcome. Thank you for joining Cottage Health and the Santa Barbara Public Library for our COVID-19 community update. At any time during this presentation, please feel free to use the question and answer feature located on the toolbar below to ask a question. We will address these questions at the conclusion of Dr. Fitzgibbons' presentation. We have close to 800 participants for this event, and we'll do our best to answer the questions that come in. Our speaker, Dr. Lynn Fitzgibbons, will be discussing the latest information on COVID-19, the Delta variant, and returning to in-person classes in the fall. After Dr. Fitzgibbons' presentation, we'll have the opportunity to hear from Lisa Gonzalez from the Santa Barbara Public Library. Dr. Fitzgibbons is the Chair of Infectious Diseases and the Medical Education Director of Quality and Research at Cottage Health, treating patients in the hospital and teaching medical students and resident physicians. She's an assistant professor of medicine for Keck USC School of Medicine and an adjunct professor in the Department of Geography at UCSB. Since the start of COVID-19 epidemic, Dr. Fitzgibbons has provided invaluable clinical expertise and direction to the medical staff and hospital leadership as a member of the COVID Incident Command Center. Her dedication to patient and staff safety has made a significant difference at Cottage Health during this pandemic. With her medical colleagues, Dr. Fitzgibbons has initiated several treatment programs at Cottage, including the COVID convalescent plasma program and remdesivir use guidelines. In addition, she actively collaborates on several research projects, including a SARS-CoV-2 surveillance testing, diagnostic development, and modeling. She received her medical degree from the University of California, San Diego, completed her residency in internal medicine at Santa Barbara Cottage Hospital, and her fellowship in infectious disease at Oregon Health Sciences University in Portland, Oregon. I'm so proud to call her a colleague. Please join me in welcoming Dr. Lynn Fitzgibbons.
Thank you, Bob. And thank you to everyone at Cottage Health, particularly Bob, Christy, and Leslie for making it so that I can just show up and talk, all the hard work behind the scenes. And also a quick thanks to the Public Library for sponsoring this event and being such a strong collaborator. I think as I was preparing for the talk this evening, it really struck me that pre-pandemic, the Public Library has been such a cornerstone in our community's public Wi-Fi access, internet access, and of course, not just literacy, but digital literacy. And so I'll look forward to, I think at the end of the conversation, we're going to hear from Lisa Gonzalez from the library, and I'll look forward to that too. Without further ado, I will go ahead and share my screen. And get started. So just to confirm what we're here to talk about, we're going to spend, as Bob mentioned, a lot of time talking about the Delta variant. We're going to review, as I always do, our community's condition, and this is as of 5 p.m. this evening. We're going to think about how this current surge is impacting our healthcare systems. We're going to talk about pediatric cases, I think the forefront of a lot of our minds. We're going to answer the question, do these vaccines work? Again, a pressing question and one that has come up more and more in these last few weeks. And finally, we're going to just talk about back to school, what that means. So jumping straight into the Delta variant. I think everyone now knows that the Delta variant was first recognized, of course, in the Indian subcontinent. It was in late 2020 that it first showed up. And then we now know, at the time we actually didn't conclusively know, but we now know when we have sequenced many of the cases through that surge, through the surge that occurred in India in March, April, and May, we of course know that the Delta variant has been ultimately the cause of that surge. Before the Delta variant, and in fact, immediately before the surge in India, of course, we here in the US and unfortunately in Santa Barbara County suffered that very, very large surge, really hitting us, of course, in December, January, February, and into March. And then while it was a blip on our radar, it's important to note that we also felt a little surge as we were coming down from the huge winter surge due to the Alpha variant, the B.1.1.7. Many called it the Kent strain or the UK variant at the time. And so all of that really then set the stage for the Delta variant and the Delta variant entering the United States and doing what it's doing right now. And so what is it doing right now? And of course, what it's doing is causing this very large and very rapid, and rapid is perhaps the most important piece here, this very rapid surge. If we look at the surge that occurred in India from March until really this week, we see just how huge and how quick an up and how quick a down the country of India, experienced. These are new confirmed cases per million people, averaged over 7 days. If we now superimpose on this the experience in the United States, you see here what I was mentioning. This was the kind of the small surge as we were coming down from the winter surge related to B.1.1.7 or the Alpha variant. But then we had those wonderful days of May and June where everything was really getting better. Things were opening, and we watched week over week as we advanced through that color tiering system from California's blueprint for a safer economy. And then, unfortunately, the Delta variant really established itself in the United States, at first just in pockets, but now really quite universally across the United States. And what we've seen is this continuous, very, very steep rate of rise of cases here in the United States that we know is, of course, now between 90 and 100% of cases Delta. So what's unique about Delta? What's it doing that's different? The most important feature that's different is simply how contagious it is. And we've talked about this, we've heard about this in the media, perhaps on our social media streams. But just to put it in, I think, a very important context, we see here a scale of something called the R0. And remember that R0 in the world of infectious diseases is simply how many other people one sick person is going to go on to infect. We think about examples like Ebola, which is devastatingly fatal, of course, in so many cases, and yet ultimately only goes on for every one case to infect a couple of other people. And I'll just point out at the far end of the spectrum is something like measles, which thankfully we don't have to deal with very often here in the United States. But of course, one of the challenges with measles was just how very, very infectious it was when it was far more prevalent, with a remarkable R0 of 18. And so when we think about COVID-19 from last year, let's call it old COVID-19, that R0 was heavily, debated and studied by many, many epidemiologists. But ultimately, I think most of us are pretty comfortable with an R0 across the board of about 2 or 3. Perhaps 3 is the best way to think about it, meaning every case of COVID-19 previously, on average, went on to infect another 2 or 3 people. And what's so different about Delta is that number has jumped. And where that exact R0 ends up falling is certainly under good study. And I can't tell you today with certainty that I know the number is going to be 7.0 versus 6 versus 8. But at the end of the day, what's important is that it has jumped and it has become, again, a far more infectious, a far more contagious cause of infection. Other important differences with Delta. This is, again, under very, very close study around the world in countries such as report from the Lancet Journal out of Scotland, reports from Canada and from Singapore. But there's some indication that if you take a group of unvaccinated people who had the Alpha variant or one of the other variants, and you look at what percentage of them needed to go to the hospital because they had severe disease, and you compare that to the same size group of people with the Delta variant and how many of them needed to go to the hospital or develop severe disease, there's some early indication that Delta may increase the risk of severe disease. Now, I always point out these are apples to oranges. The environment, the amount of vaccine protection, the people that we're talking about who are catching these infections now in Santa Barbara, California in August of 2021 is, of course, very different than the group that we would be studying if we were looking at, say, the Epsilon variant or the Alpha variant from earlier in our year. Nevertheless, I think this is an important thing to keep an eye on, especially given the concerning early data that looks like it's at least causing as severe disease in unvaccinated populations and possibly increased risk of hospitalizations. The other very notable feature of the Delta variant is just how much virus an infected person has. We talk in infectious diseases about something called viral load with viruses. And this is basically the level of virus. So if you were to swab my nose and then see how many viral genomes, how many copies of the virus were in there, we can actually do that. And what we've seen is that when we compare, again, not just one person, but actually huge populations of people, and when we look at how much virus is showing up on these tests from previous variants to the Delta variant, we're seeing a big jump. In other words, when someone's infected with Delta, and that Delta variant enters their cells, causes an infection, causes them to feel unwell, and hopefully they ultimately recover, the amount of virus that their cells start to make is much, much higher than we've seen previously. And then it goes to show that perhaps this makes a lot of sense with how infectious or contagious it is. Exactly how it's doing this is, again, being studied very carefully by a lot of virologists around the world. And I don't know that it's crystal clear exactly how it is doing this, but I think at the end of the day, the thing to remember, highly contagious, possibly correlating with more severe illness, and again, very, very high quantities of virus. The Delta variant has a unique set of mutations in its spike protein, but also other parts of its genome that are beyond the scope of this conversation, but just to mention, may well be partly, of course, related to, if not entirely related to some of this behavior that it has. And then I'm not going to go into Delta Plus during this conversation, but I wanted to mention that there are 3 sublineages now being followed, AY.1 and AY.2, which have a very specific change in the genome, a very specific mutation that gave them this nickname of Delta Plus, with the idea that that change, that mutation that they carry, may well give that variant something called immune escape. So the ability to perhaps cause infection even more commonly in people who have previously been infected or vaccinated. And then AY.3 is another important Delta sublineage that's now being followed. And again, all that I ask that we remember is that Delta itself, B.1.617.2, the WHO now, of course, asking us to call it Delta. This Delta variant has, of course, now many of its own daughter variants and sublineages, and that's what we're continuing to track. And all of these are often referred to as kind of the Delta group. So let's look at what happened. And this is why there was an infectious disease physician about a month ago, as the Olympics were getting going, who said that Delta has won the gold medal. And this is really about this graph. So if you follow me, we have from October on the left of last year until this week. And what we're going to look at first, and this is on the side, this is of all the cases of COVID-19, what percentage within a country were the Delta variant? And of course, back in October, we really didn't have the Delta variant. And then it started to kind of show up on the red curve here in India. And then a few more cases in India, a few more cases in India. And then it did this remarkably steep jump up, which, as we talked about, correlates with that awful surge that India experienced. And then, of course, it clearly had won. It became the dominant, almost the only variant being sequenced out of the country of India. And then, a couple months later, the very same thing happened in the UK. It really had been absent in the UK, and then suddenly it appeared, and it absolutely dominated, again, with this incredibly fast just replacement of all of the other variants that were in the UK. Now we're told 100% of sequences in the UK are the Delta variant. And then here in the United States, we, of course, have lagged behind India and the UK experience. But unfortunately, just in these last 5 or 6 weeks, we have done exactly what we've seen in these other countries. And we have seen, again, having had very little Delta, now Delta is 90, 95, perhaps 96% of all sequences in the United States. And so what does this mean? It means that Delta has an advantage. Delta is doing something that is giving it an advantage over all of the other variants, and it's replacing them. It's also, unfortunately, not just replacing them, but causing more illness. And that then leads us to the question of what's going on in our community right now. So here we have a graphic that's very familiar to most of you. Here we have from the beginning of Santa Barbara County's pandemic, back in March of 2020. We have basically the number of new cases every day all the way through this week, and in fact, through today. We had, everyone remembers that very small time period where we had the surge in cases that were all reported within a couple of days out of the Lompoc Federal Corrections Complex, which was this blip. But then in, I think, a more sustained way, we had our summer surge last summer. And then we had the fall, during which things were better. And then we had the devastating winter surge. And then we had the improvement. That alpha surge that I talked about was very subtle. It's a shoulder here, if you believe me. We can narrow in, and you could. I promise I can make you believe me. But we did have a good amount of alpha around March and April. This is B117. But then everything got better and better and better and better. And then what's happened, of course, since really the beginning of July, primarily mid-June, late June, we've seen the surge start again. And so let's just narrow in on these last 2 months. This is data, again, through 5 p.m. this evening. Santa Barbara County this evening reported 184 new cases tonight in the Santa Barbara County area. But again, back in June, we had an average of about 6 to 10 cases a day. It was looking very, very good. And then, we've been following this on a variant task team that I'm part of and grateful to be part of, as well as through some excellent collaborations at UC Santa Barbara, for which, again, I'm so grateful for. And of course, our public health department support. And we know that Delta basically entered the Santa Barbara County area, primarily in the beginning of July. And as Delta has arrived, so too has our surge. And so here we see just this increasing week over week number of cases throughout Santa Barbara County. So for those of us who have all lived through this last year and a half, as we all have, we know then that while we'll certainly get to schools and education, perhaps the biggest driver, what we're hearing about this evening in Texas, unfortunately, the biggest driver of how this is going to impact a community is how badly will our hospitals be impacted? And that's, of course, the big unknown. Here we see through the whole pandemic, again, from last April until this week, how many how many hospitalized and ICU level patients we had with COVID-19 in Santa Barbara County. Again, the summer surge, the winter surge. And what we're starting to see, unfortunately, is not only are we seeing community cases rise, but we're seeing hospitalizations start to rise. Even although there's a lot of noise in this data, so many ups and downs, the trend, unfortunately, really since the middle of July, has been that the number of people hospitalized in Santa Barbara County is rising. Forgive me for jumping into some interesting data related to community cases and hospitalizations. Those of you who are not fond of math, feel free to zone out for just 1 minute. And those of you who adore math, perhaps you'll enjoy this. A gratitude to Brett Tandy at Cottage Health, who has just done a phenomenal job of tracking our data internally at Cottage. And so I just wanted to share this with you tonight. Here we see every day of 2021 as a dot. And every one of these dots shows you how many cases we had that day and, how many cases we had over the prior 7 days, and then how many hospitalizations there were that day. And so if, for example, we take a day, I don't know, let's say in February, we might have had over 7 days. This is Cottage Health data, PDL data, Pacific Diagnostic Lab data. We might have had, let's say, 450 cases that week. And that week we had, let's say, 65 new admissions. And so what you see is this really nice correlation. If you look at the blue, which is everything before July, you see a really nice correlation. It makes sense. More cases, more hospitalizations. Fewer cases, fewer hospitalizations. And again, we have this really, it's a curve, but it's quite an impressive trend line. And it's one that's logical. So now look at the red dots. The red dots are from the last month. and the line has moved. In other words, for every number of recent cases, we're seeing fewer hospitalizations. It's really quite striking. And I want to thank Brett Tandy again for his help with this graphic, which he's been updating very frequently throughout the year, and actually worked hard on this just for these last couple of days to get this data for us tonight. So we should be careful, I think, not to interpret this shift in the line as evidence that our hospitals won't be impacted, because there are lots of explanations for what we're seeing. Maybe we're now testing more asymptomatic people or mildly symptomatic people than before. Maybe there are just a lot more children being infected who are less likely to be hospitalized. Perhaps there's a contribution of breakthrough cases, also less likely to be hospitalized. And so again, lots of explanations for the shift, but I think it's just another really, really good example where for so many reasons, we have to think of the Delta surge as its own beast. It's different. It's a very different surge for so many reasons. And I'm going to take this graphic away with a little bit of hope that here in the hospitals, as much as I think we're ready for whatever the surge throws at us. I'm optimistic that at least this early data is promising that we're perhaps less likely to be hit quite so hard. So let's talk about pediatric COVID-19. Kids' cases are really making up an increasing percentage of cases throughout the country and also here in California. This is the California data where we see from April of last year until, again, just this last week, what percentage of all cases were children aged 0 to 17. And of course, early on, we had very few pediatric cases, and this percentage is just increasing. And it's probably in large part due to the fact that we have a lot of good vaccine protection in older people. And what that means is that the relative case counts in adults, hopefully, especially very, much older adults, are coming down. It's also likely related to the fact that these more contagious variants are spreading more easily in pediatric populations. And it's anticipated that this percentage of all cases that are kids is going to continue to rise up. It's also important to remember that cases in kids may also be underrepresented if they're not tested as frequently, or perhaps they're tested by things like antigen kits, not reported in traditional ways sometimes, if they're tested outside of conventional healthcare systems. And so what does illness look like in children? So just as in adults, the good news is that mild illness is the most common. Our children get fevers, cough, shortness of breath, runny nose, headache, sore throat, abdominal pain, diarrhea, fatigue, loss of taste and smell. Anyone who's had to be screened for this every day can probably recite the list. But with Delta, what's interesting with kids and adults is they are probably more likely to have milder or slightly different, maybe allergic type symptoms, even, just simply a runny nose. The good news, again, is that most children are recovering within 1 or 2 weeks. And it's really uncommon for kids to have symptoms beyond 8 weeks, but not unheard of. The infectious period for most is, again, considered to be less than or equal to 10 days, less than 10 days. And so then just think about maybe some of the worst case options. The data is, again, a little bit heterogeneous in that we have to think about what populations we're looking at when we're asking what percent of all kids' cases get hospitalized. To remember that we have to think about how are they testing? Are they testing very universally? Are they only testing sick kids? These kind of questions. But at the end of the day, the best, big data on tens of thousands of cases is that hospitalization for kids seems to be necessary for up to maybe 2%. One report said 2 to 4%. And perhaps a third of those who are unlucky enough to be hospitalized do unfortunately require ICU level care. I mentioned that these are tricky stats to quote because, again, they're vulnerable to a lot of just differences in how people are collecting this data. But I think at the end of the day, the key is that it's really unlikely that children do develop severe illness and hospitalizations, but it's not impossible. And when we talk about huge numbers of children becoming infected, even a small percentage of a very big number is unfortunately a moderate sized number. What predicts which children are more likely to end up in the hospital with severe disease? Those, just as with adults, those who are medically complex, have had other complicated medical problems, perhaps requiring recurrent hospitalization, those who have weakened immune systems, those who have higher BMIs or are struggling with childhood obesity, those who have diabetes, asthma, and then a variety of other risk factors, all really related to primarily medical conditions. Talking about long COVID, or long haul, people have said, but long COVID or kind of post-COVID sequela does occur in children. It's probably less common than adults, but a lot of people are actively studying this right now, and just a lot written about this even in the last couple of weeks. And unfortunately, with the Delta surge impacting children, very likely that we'll have better data on really the prevalence of this and the outcomes of this in these next few months. I do want to mention a very rare, but unfortunately very serious condition in children, the multisystem inflammatory syndrome. This, again, unfortunately, we will find out how much this is going to impact all of our communities, really in a delayed way. This is a kind of an inflammatory syndrome that usually does not occur at the same time that a kid gets COVID, but rather a few weeks later. And again, very tragically seems to occur without much notice in kids who are previously healthy ages, can be any age at all, but more commonly in those kind of school age years, 6 to 12. Again, very, very rare, but indeed very serious. So shifting gears a little bit to the question I've been asked many times a day for these last few weeks, do these vaccines even work? Great question. It is a great question, sincerely. I have the same question. And the answer to this is yes, 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 yes. These vaccines are working to do what they were designed to do. They are preventing severe disease and death. All 3 vaccines currently available to us have done that beautifully, and they continue to do, again, what they were designed to do. But if you ask, are they perfect? The answer is no. And while we all wish they were truly bulletproof against every manifestation of this disease and could prevent both mild disease and severe disease perfectly, I think I'm personally quite grateful that they've continued to do what they were made to do. And that, of course, is prevent severe disease, life-threatening illness, and death. Let's talk briefly about the vaccine efficacy data with study, of course, 2 days ago out of Mayo Clinic, just another in, a huge body of literature that has looked at a variety of different aspects of vaccine effectiveness or vaccine efficacy. It's beyond the scope of this conversation to go into the nitty-gritty details of any of these studies. I actually had a slide prepared to talk about the Mayo study, but it's available online for people who want to really delve into that data. What was interesting about the Mayo data was that the Moderna vaccine looked like it gave very good protection relative to the Pfizer as a comparator. But both, again, for severe illness did very, very well. And so again, there's different ways to look at whether the vaccines are working. We can look at lab studies of neutralizing antibody levels. We can look, of course, at real life comparisons of populations in Israel compared to Milwaukee. We can kind of do all of these things. And these ultimately, as much as I've really read the vast majority of these studies that have come through, they're still very complicated questions to answer, given how many factors are changing in each of these studies. And so I've tended to focus on the recurrent themes that I'm seeing bubble to the surface as each of these trials has come through. And that theme, I think, primarily is that our vaccines, again, continue to prevent severe disease, hospitalization, and death. Vaccine breakthrough cases are occurring with Delta. They are absolutely occurring. We of course, saw the MMWR article out of the CDC referenced in the media a lot. And that article was the one from a couple of Fridays ago that looked at the outbreak in Massachusetts, where we really had a large group of vaccinated people fall ill from this and with high viral loads. What's not known is exactly how infectious these breakthrough infections are. We think that because they have those high levels of virus, when someone with a vaccine does get a mild case of COVID-19, we think that if they're getting a little bit sick and if their viral load is likely to be pretty high, we worry that they may well be infectious to other people. That's again, just to be clear, there's no absolutely conclusive data on that, but of course, this is really one of the primary reasons that, regardless of your vaccine status, right now, it's recommended when you're indoor in public spaces to be wearing a mask. And then the final thing to mention about vaccines, just because I think it's again hot around the media, but also I think the front of a lot of our minds, is how well does the protection last? How long-lived is it? And when or will I need a booster vaccine dose? And so, of course, we're hearing today or tomorrow that we're going to get, again, authorization for immunocompromised solid organ transplant patients and folks with weakened immune systems may well get authorization to get their booster vaccine doses. And this is based on very robust data out of the New England Journal of Medicine about 6 or 8 weeks ago. But for the more global question of the general public, I think more to come on that. In Santa Barbara County, I just wanted to show this graphic because this is, again, regardless of all the data, the question is what's happening in our community, in our real life clinical trial, our study, right? And here is our study. This is us. This is the number of new daily cases for those who are unvaccinated in orange, and the smaller number of breakthrough vaccine cases shown in green blue, really from May until, again, last week. And so I think it's easy to see from this striking graphic that, unfortunately, those in our community who are unvaccinated are really bearing the brunt of this current Delta surge. So finishing up with some comments regarding going back to school. Pause to thank all at the Santa Barbara County Public Health Department, the team working to collaborate closely with the leadership from all of our school districts. They pointed me to this excellent website this week that I just wanted to make sure everyone was aware of. It's really a rich website, California Safe Schools for All. It has information whether you're thinking, more as perhaps a teacher or a school leader or as a parent. But again, lots of great resources on this page. And then again, it's beyond the scope of this conversation tonight. I really would defer to the Public Health Department for specific details, but they are, of course, following this guidance document that was last updated on August 2nd. And this is, I would say, kind of the law of the land with regards to how the state of California is regarding COVID-19 and schools. And so I think if you're a teacher, a parent, someone who has questions about what the public health approaches are, again, there's a link to this document in that webpage I just showed you. But here really is, I would say, it's a living document. I think it will be updated as anything changes. But here really is perhaps your best reference. Beyond the scope of this conversation, but I did want to hit maybe a few of the key takeaways as I reviewed the document fairly carefully. The foundational principle of the whole guidance is that all students must have access to safe and full in-person instruction and as much instruction time as possible. That masking indoors is a cornerstone of preventing spread within schools. That physical distancing, interestingly, is really being de-emphasized as evidence has changed on this. And the idea there, again, you can read about it, is that masking prevents aerosol spread, and that ultimately has been shown to be more important than physical distancing, which prevents droplet spread when we're trying to prevent COVID-19. Universal masking indoors also allows a new approach for this school year called modified quarantine practices. And this decreases missed school days for exposed students. Of course, the days of last year, we had a positive case in a classroom, and in large part, most of that class, if not the whole class and teacher, may need to leave school for, 10 or 14 days. And so, the idea here is that with the universal masking indoors, this modified quarantine process is feasible and should ultimately really help mitigate missed school days for exposed students. And then again, optimizing ventilation is strongly recommended in this document. And I would defer any questions, Bob, for your thought as we get to questions and answers. Any specific questions regarding the public health recommendations, I would defer to public health, and we'll make sure that in our follow-up email to everyone that we do give all the links to these. And so finally, I want to talk about my last slide, wearing a slightly different hat. I want to talk as a parent about what I think we all share with regards to some universal wishes. Before I tell you what I think our universal wishes are, I would ask us all actually to pause and remember that everyone in our community is, I think, truly exhausted from this last year and a half. And I think many have been through one of the hardest years of their lives. To now be facing the Delta variant surging in our community right as we were preparing for what we hoped would be a fresh start is at the very best difficult, and at worst, I think more than many can face. With this backdrop, have around our community, in our schools, at the playgrounds, in the grocery stores, led to some very tense conversations, high emotions, and frustrations. And so as I considered kind of talking to you all tonight, I wanted to, I think, pause and remember that no matter how you're feeling about the start of school year and the current surge, we all do agree on at least these couple of things. We all wish we could rid our community of COVID-19 tomorrow. We absolutely wish that. This is my magic wand, and if I find it tonight, I promise that's my first wish. Our second wish, though, I think, is keeping our kids happy and healthy while also learning and growing. And so then again, I want to squarely put on my parent hat for my last few comments. We want our kids safely in school. We want them in their sports. We want them in the activities that enrich their lives, help them to thrive, and help them as children to recover from this very difficult past year. I think as a parent, I'm carefully considering the benefits of masks and the best settings for them for my children. I want my kids to see smiling faces, but I want that to be outdoors. I know that with these modified quarantine options, masks in the classroom will not only protect their health, but it should keep our kids in school more. If we have the choice for our kids, we will have them playing outdoors, because even before COVID, that was the right answer. And finally, vaccines do, of course, remain the best way to protect everyone who is eligible from severe COVID-19. If I think as a parent, I have a child who's 12 or over, and I know what is about to hit our community with regards to the Delta surge, I think there has never been a better time than now to learn everything that you can about the benefits of vaccines. And with that, Bob, I will stop sharing and send this back to you.
Thank you, Dr. Fitzgibbons, for that presentation. We'd like to begin now with the question and answer session. So if you have any questions, please put them in the Q&A by clicking the Q&A button at the bottom of your Zoom screen. I'll then read the questions for Dr. Fitzgibbons. We've already gotten a great amount, so really appreciate the questions, and please continue to send them in, and we'll get to as many as we can. Dr. Fitzgibbons, one common theme in the questions revolving inside the classroom, not just for children, but for teachers, on any thoughts you had on the type of mask, N95 versus cloth versus a face shield.
Great question. So let me just give the best answer first, which is the more ply, the more layers, ultimately, the better, to a point. And what that means is probably the worst protection is a single layer of cloth. Multiple layers of cloth, a medical grade mask, or something else that, again, it doesn't have to have a tight seal, but ideally tighter is of course better. And I think of course, take that to an extreme, which is, the best way to prevent COVID-19 completely would be to sit in a bubble at the front of the classroom, which is not feasible for any of you hardworking teachers. N95s, if you know they fit you correctly, which is sometimes actually a little tricky. Of course, in healthcare, we do very specific fit testing to make sure that they fit correctly. N95s probably give the best protection. The challenge is that if you speak to our physicians or our nurses who've been doing this work for months and months and months, keeping an N95 on, an N95 that fits on for days and days and days on end is actually very, very taxing. And so I think at the end of the day, everyone needs to make the right decision for themselves. I think basic principles are making sure that whatever you're wearing is tight fitting, and making sure, again, that you have not just a single layer of cloth protecting you. The final thing I'll comment on is that there was this, I know the case report, there was a case report from a corrections institute in, it was fall of last year, that really was the beginning of a lot of conversation about the eye exposure and the face shield. At the end of the day, that really hasn't been shown to be a very common or efficient way for this virus to be transmitted, meaning if I'm wearing a good mask, and I get exposed through my eyes, that's again that's not a common or easy way for this virus to cause infection. So please remember that you really are getting very, very limited additional protection from goggles or a face shield, and where you're getting the most bang for your buck is with that good multi-ply cloth mask or medical grade well-fitting other mask.
Great. Thanks so much. And a lot of other kind of similar questions on masks in schools, but really more to children being outside. Any downside to them wearing masks if they are outside, and with recess and eating outside, things like that. Your thoughts on that.
Thanks. So people can look at the guidance document from the California Department of Public Health to see the exact language used. But outdoor masking is described in that document as optional. And I believe that's the opinion of our public health officials also. The fact of the matter is that with Delta, we are really just learning as we go with regards to, whether it really is capable of, of infecting, perhaps in a condensed outdoor environment or not. And so at this point, again, weighing benefits with known harms, the state is saying that, outdoor play without masks is a reasonable option. I think that for children who are going to be playing close to one another, in close contact with one another, not necessarily on the handball court, but perhaps sitting in the sandbox and playing, wearing masks is going to be a level of protection that may well be beneficial. But every school, in close collaboration with the public health department, every school and indeed every teacher, and I think every parent also needs to weigh this against, I think what we all know, which is for our children to spend, season after season wearing masks and not seeing other people's faces is something that we worry about from developmental perspective, from simply a compassion perspective. And I'm sure there are some sophisticated educational scientists on this call this evening who could speak much more wisely about me than this. And so I think it's just a case of, I think, balancing these things. Ultimately, I'm happy to say, I am comfortable with my kids running around a playground without a mask on, but if they end up sitting down and playing for a concentrated period of time with a crowd of other people, I would favor that they were wearing a mask, because they're just statistically so much more likely to be sharing that same air for a prolonged period of time.
Great. Thanks for that. Another popular question is, any advice on an empathetic or educational way to help people have conversations with friends or family who at this time are unvaccinated?
It's a great question. I think what I love about the question is I think that the approach of leading with empathy rarely takes you wrong. And I know that emotions are high and that people are frazzled. And And it's hard. I mean, I walk into Cottage Hospital every day, and you know, people have been working really hard for a very long time on this disease. And so I think my tact, again, I'm speaking not as a doctor or even as a parent, but just as a person. When I found myself in that conversation, I always try to start by understanding where people are coming from. And I think that more certainly we know that misinformation has spiked in this last 2 weeks. We know that in sophisticated ways misinformation is being propagated in perhaps certain channels by certain forces. At the end of the day, I think one question I have is someone's opinion, is someone's decision not to get vaccinated based on perhaps one of three things? Is it based on them seeing information that's different than the information I'm seeing? And what is it that they're seeing? And try to understand what they're seeing, where it's coming from, and try to get my head around that. The second is, and I think this was actually more true earlier in the summer, are they just apathetic? And I don't mean that in any sort of negative way, sincerely. I think we had at the beginning of the summer a lot of young adults who just hadn't been impacted by this, other than they worked from home for all of last year. They themselves didn't feel at risk. They perhaps didn't really know anyone who'd been hit hard by this. And then getting the vaccine was just, another half hour out of their day. It wasn't clear to them that it was going to benefit them. So again, I think there's that middle group where people, again, didn't really understand the benefit from them. I hope that we're getting some traction with that group and really helping people understand why it's such a good idea to get vaccinated, that you want to avoid severe disease and all the other benefits. The final, though, is, again, starting with the place of empathy, fear. People are scared of something that they don't know that they can trust. And I think that especially early on, there was a lot of fear around side effects and safety. And so I think continuing to communicate with our friends and our loved ones who are perhaps more vaccine hesitant, try to understand what it is that's driving that, that feeling. And then at the end of the day, I think doing whatever we can, again, this is an editorial, not a science-based fact, but to try to stop these relationships from fracturing, but rather stay kind of shoulder to shoulder with one another, and continue, I think, to try to make sure that everyone has access to really good information. So hopefully some of that is helpful.
Great. I'm sure it is. Thanks for that. Any update on when you think vaccines may be available for children under the age of 12?
Yeah, every meeting, someone has an opinion on this, that I don't know that much of it's founded on much. There had been some ambitious projections, of course, last May or April that looked like it could be the end of the summer. And those ultimately, I think by June were clearly false. The latest on a meeting I was on yesterday, or Tuesday, excuse me, was December that I had heard for the older group within there, not necessarily the younger kids. And so I think hopefully halfway through this school year, if not sooner, grateful again to our public health department, speaking to them just today and already kind of thinking through preparations for how we as a community would, as soon as that's available, make sure that we had capacity to provide that throughout our community. But I think at the end of the day, we are squarely entering a big chunk of this school year without that option for our kids.
Next question is, out of the hospital admissions that you see, what percentage of the people are unvaccinated?
It's thankfully, again, at Cottage thus far, we've had smaller number of admissions in these last 2 to 3 weeks as we've really started to feel the Delta surge. I understand, again, this is publicly available data, but I understand that Marion Regional Medical Center in Santa Maria, unfortunately, in the last week has had more admissions. And we anticipate with just, again, our big jump yesterday and today with the huge number of cases that it, of course, takes, maybe a week for us to start to feel that in the hospital, but we know that that's coming. So the percentage, we've started to look at it every single day. The percentage that are unvaccinated of hospital admissions, again, the numbers are small in the last 3 weeks, have been right around 90%. So 90% of this is hospital admissions with severe COVID-19. So just to be very clear on the denominator. So of all the people coming in with severe COVID-19, some days it's 95%, some days it's 90%. It's in that kind of range. So the overwhelming majority of people coming into the hospital with severe COVID-19 are unvaccinated.
Any update on information about pregnant women and the vaccine?
Great question. Thanks for that one, whoever asked that. Yes. So unfortunately, we know, not just from anecdotes and case reports, but now from incredibly robust data, that pregnant women are more likely to suffer from severe COVID-19 and even more likely to end up in the ICU. Without getting into details, I'll share that we've had some experience with this locally also. What that means is that the American College of Obstetricians and Gynecologists, as well as the CDC, as well as the Infectious Disease Society of America, all of the national organizations have now, even just updated in the last month, come out with very, very strong statements of strong recommendation that pregnant women should be getting vaccinated. Now, there are a lot of questions that come up surrounding these vaccines and the safety data. And so it continues to be looked at very, very, very carefully to see what kind of complications pregnant women are having with these vaccines. And again, the good news is I can tell you now, even more than I could tell you a month ago, and more than I could have told you 6 months ago, that the safety data continues to look very, very good. There's a wrinkle that I want to be really clear about, because people always ask me about it. They've heard that women's menstrual cycles are perhaps thrown off after the vaccination. So not pregnant women, but let's say a preconception woman, someone who's thinking about getting pregnant. And that's indeed the case with really very, very many illnesses and vaccines. That the mild inflammatory reaction that's brought on by the vaccine does very often change by a few days a woman's menstrual cycle, and that's certainly been shown with this vaccine, as with again many illnesses and many vaccines. That has not correlated with big data fertility problems. And again, at the end of the day, if my loved one was asking me, saying I'm pregnant today, should I get vaccinated? I would say yes, 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 yes.
Right. Thanks for that. Next question is, how is the medical community preparing for a possible increase in pediatric cases?
So what we've seen across the country are children's hospitals that have been, just overwhelmed by a relatively large number of pediatric cases. And I think here in Santa Barbara, we're very fortunate that we have a great children's hospital here within Cottage Hospital with a lot of capacity, with a lot of excellent local expertise, and with a lot of capacity. We've had pediatric cases actually throughout the pandemic. We have continued to care for children who've come in with severe COVID-19, both ICU level care, unfortunately, sometimes, as well as on the general floor. And we've been able to do that safely. Again, have had good outcomes. And so I'm confident that we have the capacity and the expertise, but it's something that we're watching very, very carefully. The other nice thing is, because we have a children's hospital within the hospital, we have the ability to flex in a way that I think just gives us extra reassurance. Just as, 18 months ago, we didn't have a single COVID unit, and then we had one COVID unit, and then two, and then three, and then four, and then back in January, February, we had 5 full units full of COVID patients. Just as we were able to flex and pivot through, again, I think very, very hard work by our healthcare professionals here at Cottage, and I know at our partner hospitals too. I'm confident that we'll be able to rise to that challenge, but I really, really hope that we don't see it.
Thanks for that. You had mentioned earlier that, the amount of disinformation that's out there. A few questions have come in about any specific source that you recommend for accurate information that people can go to. And I think also using that source maybe when they're, talking to friends and family about the importance of vaccinations.
Yeah, thanks for that. So I think that what I would probably say is Again, there's a lot of information of varying levels of, I would say, scientific sophistication, but that's actually very, very readily available. So I think I personally ask people to lean in to the trickier scientific papers if you're interested. If all you want to do is read the abstract, read the abstract. If there's something that flies by, I mean, what I love nowadays about our media is that a paper is referenced in the body of an article in the lay press, and that usually has the link to the article. Click on the article. You don't have to necessarily understand every word, but you might understand a lot more than you expect to understand. And again, it's often a rich source of information. So I would say, first of all, lean in to learning more from actually the direct sources. Empower yourself, empower the people that are asking you those questions. I think secondly, there's a link I actually would love to share, Bob, with you for sharing with the group. That is a wonderful summary of, it's school specific, but it's maybe 200 pages of just references by topic, put together by a group of experts from Boston, from Mass General Hospital, that I have continued to find as a really good reference. If someone asks me a specific question about a specific topic related to kids in schools, it's a rich document with regards to direct links to a variety of papers or just summaries of things. And so that's another great source. The CDC is, of course, a good place to go to. But again, I'm sympathetic to the fact that we've had periods of time through this pandemic where sometimes the CDC guidance or recommendation has been perhaps a little bit slower than we would have liked in catching up with kind of what's happening on the ground. And so I know people have varying opinions about that as a primary source, but it's a great resource, lots of good links there. So I think hopefully that's a good summary, and we'll try to include those in some of the information that we send out.
Yeah, that's great. And just so everyone is aware, we will be sending out this recorded presentation out to everyone in English and Spanish, along with some additional information as well. So thank you, everyone, for your questions. Thank you, Dr. Fitzgibbons, for taking the time to answer those. It's now my pleasure to introduce Lisa Gonzalez. She's the senior librarian from the Santa Barbara City Public Library. Lisa will be sharing some short details about resources for students and parents. So please join me in welcoming her.
Hi, everybody. I'm hoping you can see me. I can't see me, but that doesn't mean you can't. And I just want to thank Cottage so much for this really valuable presentation. I was scanning through some of the questions myself and just really recommend that if you have specific questions, you call your medical professional. There's also information lines from public health. There were some questions there that I'm sure you really need an answer to. And unfortunately, we just didn't have time for all of them. But I couldn't pass up this opportunity to remind everyone that we really want to partner with you through this experience. I mean, I love the way Dr. Fitzgibbons framed this for us as we're in this together as a community. I'm really proud of our community. I recently left the state to visit family, and it made me really value what we have here in Santa Barbara. We have a lot of caring folks that really want to keep each other safe from getting sick. And so that's why I'm so glad we could participate in this program. And at the same time, what are we going to do with ourselves as we're trying to find new ways to interact in safe venues? I did want to let everyone know that the library is open. We've opened our building. We never stopped using masks because we consider ourselves a youth-focused organization. We want to be a safe place for everyone under 12 who is unvaccinated. So whether or not the community around us is mandated masks, chances are we will be mandated masks until we feel that it's safe for children to be without them. So bring your mask to the library. But if you don't feel like coming into a public building, that's fine too. I wanted to make sure people knew that you can get a library card for anyone in Santa Barbara Unified School District simply by opting in the ARIES registration process. And then though there's no physical card, your student just needs to know their student ID, or if they're young enough, you might need to know their student ID. And then it's 2144-7000 plus their student ID. If you have questions about how to opt in, how to access that card, there's a YouTube walkthrough for you in either English or Spanish or both. And it's a great way to make sure that our students have access to all the digital resources. I know we're so tired of watching our students in front of their iPads. I have two young ones. Well, I have a high schooler and a 2-year-old, which is a great mix. but there are a lot of resources that are free. And so as anyone who's in SB Unified can actually have 2 library cards and 2 accounts. So they could even have a pleasure reading account and a student account that's more studious for them. And all these little icons you see at the bottom of your screen represent different learning experiences that you or your students can have. We can review languages, Mango Languages, Libby, Overdrive, Anki are all great for ebooks, audiobooks. There's an amazing selection of graphic novels on Hoopla. I know some of our kids go through those so fast. Free access to the New York Times every day, so we can stay up to date on the latest information. We also have all kinds of digital databases. We have Edson Smith local photos. We have a digital encyclopedia because we can't carry that in print anymore. It just goes out of date so fast, just like as you see this information changing so quickly. Canopy for films. Anyway, a lot of good things for you to explore. We're happy to walk you through over the phone, let you come in. In terms of being connected digitally, we have hotspots and laptops for checkout. Our computers are open in the building once again, as long as it's safe to do so. And we're just really wanting to make sure people get the information that they need so that they can make the best choices for their family. So if there's any way we can assist you through this, of course, we're going to let the experts be the experts. And we thank you once again, Cottage, for all your hard work and all the staff that are really putting themselves out there to keep our community safe. But if you have any questions about anything the library can do for you, please check our website or give us a call. And during open hours, we're open Tuesday through Saturday these days. We're happy to help you. So thanks so much for everyone who joined us today. Thank you, Cottage, once again. And it's just been my pleasure to be part of this. I'm going to be recommending this presentation to all the library staff tomorrow and a lot of my my community as well.
Thank you, Lisa, and thank you all for joining. Again, a recording of this presentation will be emailed to you shortly. Should you like to review it or share it with others, we will also include some resource links that you heard about today as well. A brief survey will pop up after this webinar closes. Please share your thoughts with us. We always like to take that feedback and try to improve the experience for everyone as much as we can. Thanks again, and have a safe and healthy night.